everybody. Today is Wednesday, February 19th, 2020. My name is Gordon MacNeill. I'm the chair of the Standing Committee on Health and Social Development. Excited to have some guests here today. In the committee, I'll just introduce everybody. We have Heath MacDonald, MLA Heath MacDonald, Stephen Howard, Ola Hammerland, Natalie Jameson, and Corey Deega will be joining us very shortly. So we have a little bit of, we have two presenters today, so take your time as always, and I'll kind of flow questions at the end, and we'll make sure that you're feeling comfortable to get your message across, and that's the main thing. Can I get an adoption of the agenda? So, Heath MacDonald. So today we'll be getting a briefing from Promotion Wellness Preserving Health Action Plan Implementation Council. We have one of the co-chairs, Dr. Olive Bryanton, is here today, so we're excited about what you've done for Prince Edward Island and your pursuits lately just to inspire Islanders. So thanks for being here. And co-chair Shaun MacNeill, council members Jennifer Burgess, and council support staff Catherine Fries. So at this time, I'll pass it over to you. Feel comfortable to speak, and we're excited about your presentation.
All right. Thank you, Chairperson MacNeill, and members of the Health and Social Development Standing Committee for the opportunity to meet with you today and provide you with an update on the work of the Promoting Wellness, Preserving Health Action Plan Implementation Council. It's a bit wordy, probably just shortened to Implementation Council hereafter. So, excuse me. So our plan today, as you'll see, basically we just want to provide an overview of the Promoting Health and Preserving Wellness Action Plan. It's a provincial action plan for seniors, near seniors, and caregivers. We'll also introduce the Implementation Council, which has been charged with developing a work plan and collaborating to achieve progress on the recommendations that are found within it. And we'll offer a high-level status update in terms of the work of the Council, the implementation activities, and an outline of the work that we've planned for the year ahead. I will preface this slide by saying I am no demographer. It's not my area of expertise, philosophy major by trade, so if anybody has any deep probing questions on this, I probably can't help you, but I will. I could bring back any information that the committee would like to have brought back. Having said that, we do have, there's some information here in terms of the demographic situation that necessitated some of this work. Like the origin of the action plan begins with the demographics. Like other Atlantic provinces, PEI is home to some of Canada's highest population proportions of older adults. So again, this is sort of common across Atlantic Canada, and we are sort of leading the country in this respect. Right now, 41% of Islanders are aged 50 plus, almost 20% are aged 65 plus. Within 5 years, that age 65 plus cohort will grow to nearly 1 in 4. And the number of Islanders 85 plus is also growing and will continue to grow over the course of the time period outlined in this slide. Within 10 years, 1 in 9 island seniors will be 85 years of age or older. This will influence program and service planning for government. It presents challenges and opportunities, I think it's safe to say. Yeah, in the slide, overall, it just shows the continued growth of those aged 65 plus. This cohort is expected to increase over 40% in the next 10 years. And a lot of people, we've been talking about the baby boomer demographic and sort of the implications that this has on the system and on society. I think everybody's pretty familiar with it, but we're definitely seeing some of that now. In response to these changing population demographics, in 2017, the Departments of Health and Wellness and Family and Human Services launched an engagement process to develop a strategy to support the improved health and wellness of seniors, near seniors, and caregivers. And Jennifer will talk a little bit about the plan that was developed.
So the development of this plan was led by an executive advisory committee. There were representatives similar to our representation here today. There were representatives from the community, from Health PEI, the Department of Health and Wellness, and from the then Department of Family and Human Services. We spent a 12-month period of time consulting with the community, hearing the voices of people from across Prince Edward Island. Some of the individuals and organizations that we spoke to and gained information from include recognized experts in the field of gerontology, both here in PEI and across the country as well. And it's interesting to note that we seem to have a number of experts in the field of gerontology that whose origin is in Prince Edward Island. So we're fortunate in that way. We had 2 large group community consultation meetings called symposia with a very diverse group of stakeholders that were able to participate over the course of that period of time. Focus groups were held with a number of organizations, nonprofits, and community service providers, some of whom would be the Senior Citizens Federation, the Mi'kmaq Confederacy, PEI's Council for Persons with Disabilities, Francophone seniors organizations, the Alzheimer's Society, Arthritis Society, and other groups. And we also assured that in many ways we included the voice of older seniors, including a piece of research that had them participating using something called photo voice, or a situation where they would take photos of meaningful information that they wanted to have incorporated in the plan. So in total, we had more than 250 Islanders contributing to the development of the plan. We're very pleased about that. Some of the action items that you'll see in the plan are representing new initiatives. Others are more about enhancing current programs or services that have existed on PEI to better serve Islanders as our demographic shifts somewhat. Following this consultation phase, the Promoting Wellness, Preserving Health Action Plan was developed and released to the public in May of 2018. The action plan is guided by the vision and mission, which you see here, which was developed during the consultation process. So that vision is one of an age-friendly health and social system that promotes wellness and preserves health. And the mission of the plan is that Island seniors will be empowered, respected, valued, and socially connected within an upstream and age-friendly system. Islanders will live in a province that promotes wellness and preserves health.
So I'll take back over for a minute. The recommended action items, they were organized into 4 pillars. So they're depicted on the slide. Essentially, develop and implement a home-first approach to some of the initiatives involved. Incorporate an age-friendly approach to communities, housing, workplaces, and healthcare facilities. Address ageism and support active aging. And support upstream endeavors that address the social determinants of health. So in paraphrasing that last one, it's rather than sort of responding to the health and wellness problems after they occur, the focus is towards health promotion and addressing the root causes of issues before they occur. So just some people aren't sort of familiar with the term upstream. It's come up a couple times, but essentially it's that sort of prevention and health promotion aspect. So we'll look at each of the 4 pillars individually and talk about the kinds of recommendations that fall under them. So the goal of Pillar 1 is to offer services and supports to enable older adults to stay in their homes and communities. That's that home-first approach. The priority area also has a strong emphasis on caregivers. Anecdotally, one of the things that we've talked about a lot at our committee level at the Implementation Council is that some of the stressors on caregivers are significant, and the pressures on them. And so it's an important group that when you think about seniors, the folks that helped care for them, they're an important cohort. So some of the recommended action items include strengthening restorative care so older adults can safely return to their community following a hospital stay. Improving access to care for frail seniors with complex needs, exploring ways to further support caregivers, and that one's pretty open-ended, and continuing to engage in the implementation of the National Dementia Strategy. Priority Pillar 2 is around incorporating an age-friendly approach to communities, housing, workplaces, and healthcare facilities. This term, age-friendly, may be a familiar one, as the City of Summerside and other communities have taken steps through projects and programs, such as the very successful Age-Friendly Business Recognition Program in Summerside, to enhance age-friendliness of their communities. An age-friendly approach considers the following 8 dimensions. So there's outdoor spaces and buildings, transportation, housing, social participation, respect and social inclusion, civic participation and employment, communication, and community support and health services. So there's a variety of aspects of community life that are sort of addressed through this age-friendly approach. And some of the recommended action items under this priority pillar include implementing an age-friendly communities recognition program, so to draw attention to the good work that's being done. Enhancing geriatric and dementia training in the health system, so helping it to kind of better address some of the needs of some of these populations, and supporting older adults and caregivers in accessing information and navigating the health system. And again, that's something that we've talked about at the Implementation Council a fair bit.
So I just got you to repeat the 8 again.
Sorry, yes.
Really quickly, yeah.
So outdoor spaces and buildings,
Yeah.
transportation, housing, social participation, respect and social inclusion, civic participation and employment, communication, and community support and health services. And yeah, if you could like, I could give you my sheet with all these great notes on.
So that's great.
Yeah. So priority pillar 3, has a renewed focus on active aging, along with initiatives to reduce stereotypes with an aim to improve the wellness of island seniors. So ageism is something we've talked about, and obviously the need to support active aging is hugely important. Some of the recommended action items here is promoting positive images of aging, strengthening sport and recreation focus on active aging, and promoting volunteer opportunities for island seniors. And so each of you, for the record, you've been given a copy of the full strategy, and so underneath each of the areas you will see there's much more detail and a number of recommendations. So we're really just providing a flavor, highlighting a few that folks may find interesting, and that we just wanted to draw a bit of attention to. The goal of priority pillar 4 is to promote health and wellness of island seniors by taking action on the factors that shape and impact health. So again, that's that upstream approach to addressing the social determinants of health. Some of the sample recommendations under this include exploring innovative housing options. We know housing is a significant issue, not just for seniors, but a number of populations, but seniors as well. Developing innovative community-based services to support healthy aging, and building on the success of the Seniors Independent Initiative. And so I will now turn it over to my co-chair, Olive, to talk a little bit about the committee, or the council itself.
Thank you, Sean. So as the co-chair of this council, I too want to thank Chairman MacNeill and the members of the Health and Social Development Standing Committee for this opportunity to provide some update on what work has been going on. So in 2019, government endorsed the formation of an implementation council comprised of community representatives and representatives from key government departments and agencies that were referenced in the action plan, and which led to the specific recommendations that are put forward. Members of the council were identified through a public recruitment process coordinated through Engagement PEI, and members of the current members represent seniors, near seniors, those with experience in caregiving, francophones, Acadians, non-government organizations, academics, francophones, urban and rural communities. It is also anticipated that the diversity of islanders' experiences will be represented on task task teams that will be commissioned to take on specific projects. The Departments of Social Services, Social Development and Housing, and Health and Wellness are continuing their collaboration in moving the plan forward and will share co-chair responsibilities with a community representative each year, and I happen to be the community representative this year. To advance the recommendations contained in this action plan, the Implementation Council will monitor progress where work is already underway, will act as a resource to government departments, agencies, and groups that are leading the recommendations, and will establish working groups as required. Now off to Catherine.
So since the release of the action plan, there's been progress on a number of the recommendations, and so we wanted to provide perhaps a few highlights across each of the pillars for your information. Under pillar number 1, the Seniors Independence Initiative has assisted over 800 islanders with funding to secure support with day-to-day tasks such as transportation, running errands, snow removal, grass cutting as the weather turns, and meal support. And these are all functions, activities of daily living that can really help older adults to stay longer in their home. Another recommended action item that falls under this pillar is to improve access to care for frail seniors with complex needs and support individuals to remain in their communities. And the nationally recognized COACH program, Caring for Older Adults in the Community and at Home, is an excellent example of this. It started out as a pilot program in Montague, and since that time has scaled to Surrey, Charlottetown, Summerside, and O'Leary. And as you may have read in the news, it's been associated with reducing hospital admissions by 66%, reducing emergency department visits for people enrolled in the program by 1/3, and 50% fewer primary care visits. Under pillar number 2, one of the recommendations here included a review of long-term care financial assessment policies to provide a more equitable balance between an older adult's costs of living in long-term care while recognizing the needs of their partners who are still living in the community. And last month, again, you may have read an announced policy change to long-term care's subsidy assessment process that will now allow a spouse living in the community to retain either half their family income or a new minimum amount of just over $22,000. For some spouses living in the community, this has made thousands of dollars of difference. And in the first year of implementation, it's been identified as being a policy change assisting at least 80 island families. Another example of progress on pillar number 2 is around a recommendation that involves enhancing the specialized training of healthcare providers. And our healthcare providers that work in long-term care have access to ongoing support and training on programs such as the Gentle Persuasive Approach, Dementia 101 and 102 courses, which were offered by the Alzheimer's Society to our long-term care facilities, and case management training, which was across several health provider groups in our health system. Under pillar number 3, we wanted to highlight a couple of examples of grants right now that local communities, non-government organizations can access in order to enhance the active engagement and participation of older adults. The Department of Health and Wellness Grant Program provides such funding. And another great example of this is the Senior Secretariat Community Grants Program, which provides funding to those various community seniors clubs and other organizations to promote activity and social involvement. Another recommendation that falls under pillar number 3 was around opening passport to employment to individuals 65 plus. And this program is open to Islanders age 65 and over. And so there are some opportunities to promote increased public awareness of this program, which helps people 65 and older who may be interested in entering or re-entering the workforce to gain necessary job search skills and employment skills. And under pillar number 4, we wanted to highlight the progress that's been made under the Provincial Housing Action Plan in developing new approaches to meet the long-term housing needs of older adults. So this has included development of new seniors housing units and continued funding for the Seniors Independence Program, the Seniors Safe at Home Program, and the Seniors Home Repair Program. So those latter two focus on funding that is available for older adults living at home to assess the place where they're living now and to see if there are some renovations or changes that may be beneficial to allow them to live in safety and comfort longer at home. And another action, the final one I'd like to highlight that falls under pillar number 4, is one that was recommended to initiate a public awareness campaign to increase awareness on the risk factors and early signs of dementia. January, as you may know, is Alzheimer's Awareness Month, and over the last 2 years, the Department of Health and Wellness and all of government have collaborated with the Alzheimer's Society of PEI to launch awareness campaigns. The Let's Talk Memory campaign in 2018 and 19, and this year's past campaign, I Live with Dementia, which helps to increase awareness of Alzheimer's disease.
Back to me. Catherine had just described, I think, some of the things that are underway. I guess I'll be talking a little bit about sort of the plan looking forward. In the year ahead, the Council will continue to monitor the progress occurring on the recommendations that are currently underway and being led by specific government departments, agencies, or community partners. I've stolen Catherine's turn of phrase on this one. She always says there's eyes on the file. So these aren't things necessarily that the Implementation Council is going to take a leadership role. As was talked about earlier, I think by Jennifer, it was a very collaborative process of bringing the action plan together. And so various parties sort of made commitments that they were going to proceed. So even prior to the creation of the Implementation Council, people started to advance some of the recommendations that they committed to. And so in those instances, the role of the council is largely just to keep track, make sure things are on track, and we're just kind of monitoring some of those recommendations. We'll also be seeking opportunities to contribute to achieving process on these recommendations. So if there's an opportunity for the council to serve as a resource to an agency or body that's advancing a recommendation, we've kind of offered ourselves up. As I said at the outset, we do have seniors, near seniors, and caregivers all represented on the council. So we've put ourselves out there as a voice that you can, sounding board. You can seek feedback from us or whatever. In addition, the Implementation Council has identified 3 recommendations from the action plan that are not currently being led by organizations as priority work items, and so we're going to try to advance those directly. Those are on the board. Explore ways to further support caregivers by considering new initiatives. That's fairly general, so it's one of those ones that we decided we probably need to think about what that means and where we'd like to see it go. support island seniors and their caregivers in accessing information and navigating the health system. Again, system navigation and accessing that information in a useful and user-friendly way was something that came up. I think it's come up multiple times as we've discussed and deliberated as a council. And explore innovative initiatives to enhance social connectedness for seniors. So these three recommendations were prioritized in consideration of their importance, their feasibility, and their potential impact and benefit to islanders. So we've kind of, the last little while, we've been going through the recommendations, trying to prioritize and basically develop a bit of a work plan for our council for the time going forward. Appreciating that there are individuals and organizations with an interest in these issues, working groups composed of members of the council and other stakeholders will take on this work. The working groups will continue to report back to the Implementation Council on their progress. So again, it'll be a matter of the Implementation Council both overseeing, I guess, the advancement of these and also providing a bit of a resource as it proceeds. And I guess that's about it. In summary, the Implementation Council, with strong community representation, has been formed to monitor and support progress on the action plan. The members of the council include individuals with diverse experiences and perspectives, and that's certainly come to light during our deliberations. As outlined in the presentation, progress is ongoing on the recommendations from the action plan, and there's a work plan to address outstanding recommendations. So on behalf of the council and my co-chair, we'd like to thank the standing committee for the opportunity to present here, and we appreciate the time on your agenda. Thank you.
Thanks a lot. That was a great presentation. I think we do have a bit of time for questions, so I think there's a lot of information there. And what I'm going to do now is open up the floor for the committee to ask any questions. And again, keeping in mind we'll do about 20-25 minutes of questions. So I'm not going to put limits on your questions, but just make sure we'll move along. So we'll start with Heath McDonald.
So this is year number 3 for this?
It's the first year for the council itself. Sorry, for the Implementation Council itself. So the report was released
2019.
No, 2017? 2018, sorry. Okay. So the report was released in 2018. A couple of things sort of took place in the interim, one being the election. As the business of government tends to slow a little bit during those kinds of writ periods because there's there are limits on what can be announced and what kinds of decisions can be made, etc. And so in September of last year, we had our first meeting. So leading up to that, we put out the call for community representatives who were interested in serving on the Implementation Council. The other thing I will say is that in the interim between the release of the report and the creation of the council, because there were recommendations that various agencies and organizations advanced in terms of including it in the report, there has been a lot of work going on in the background, despite sort of in the absence of the Implementation Council. And it's more, I think, the Implementation Council, we looked at the need to really make sure in a coordinated way that some of those ones that aren't necessarily identified with a specific body or agency, that we'd want to make sure that those were continuing on as well.
I guess as an MLA, you get a lot of, I think these programs are great, and this is great too, don't get me wrong, but you get a lot of questions as an MLA, as I'm sure most of us sitting here do, in regards to some of these programs. So the navigator that you talked about, or the navigator, is that a position, or is that something you're working towards, or is it, and I know we have senior secretariat and what have you, Catherine, but it'd be really nice even for an MLA to be able to say, here's where you go to talk to about housing, and we have a housing navigator in that department, or here's where you go to talk to about the Senior Safe at Home program, or it seems to be splintered. And coming from government, I found it hard. So I can assume seniors, maybe with no technology in their household as well, and that's something I'll get to too, because I think there's an opportunity for you there. But I'm just wondering where the navigator position falls, or if that's been created yet, or...
Yeah, so I guess a couple of things, and other folks can jump in as well. I think there are, within clusters of services, there are already some navigators. And so within the health system, there are already a couple of navigators embedded within the system. We certainly bring back specific information on those, and I suspect it's the same in other areas as well. But there isn't sort of a 1-800 number that a senior can call at this point in time that could, provide all the information that he or she may need in terms of service provision. As we said, that is one of the recommendations that we're looking at in terms of supporting island seniors and their caregivers in accessing information and navigating the health system. So it is a recognized continued area of need. It's one, our intention is to form a task group, think about what some of those solutions could be, how we could provide supports that would kind of meet that need. So that'll be the kind of work that's underway in the next year. Which isn't to say things started in year one will be concluded by the end of year one. We haven't, until we sort of unpack them, start to really roll up our sleeves and get into the meat of some of these recommendations. We won't know exactly sort of how much work is involved and what the time frame is, but the intention will certainly be to have some focused attention on them and try to conclude them and, I guess advance them during the lifespan of this implementation council.
I think it certainly was discussed at our meetings, and one area that we will be looking at is the United Way 221. I think that's an area we could look at to collaborate with, to have a navigator who's going to be there who knows where to go, and call there and find out who you should contact, and you're going to get a live person to answer the...
Yeah, they have a 211 program, and
we're quite excited with that.
Well, it's interesting because David Webster, who is quite a key figure in advancing the 211, he's actually a member of our council.
Yes.
As well. So we have really good connectivity to that. I'm quite confident that he'll be involved in some capacity when we look at this recommendation and sort of some of the solutions to it. So.
Just one more. In my previous life, I've actually dealt with Catherine and Olive on accessibility issues, and just wondering, and we brought in the National Building Code obviously not too long ago, and to me it doesn't really go far enough, and when we're dealing with an aging demographic as such, what we're dealing with and the percentage of those that have disabilities, and now we're at 1 in 4, you say. What's our measurement tool for these communities, for these social housing projects? Like, how do we measure that they are actually adapting to? And when the baby boomers was first announced, and I remember it yet on CBC with Peter Mansbridge at the time, everybody get all excited, and all we seen were signs saying senior friendly. But nobody knew what senior friendly really meant. So I guess what I'm saying to you is, what tool can we measure the accessibility issues that we're going to be faced with, ongoing issues that we're going to be faced with an aging demographic? Or can this be a part of, if we don't have it to the extent we should, can this be a part of one of these 4 pillars?
I don't want to speak on behalf of the other members, but I think there are certainly, I guess, one way to think of it is the recommendations here, they aren't sort of seen as a complete picture of everything that needs to be done in the areas of addressing the needs of seniors. But there are, I think, aspects of the recommendations where you could bring that in. I'm thinking even in terms of the age-friendly stuff when it comes to built infrastructure, as an example. But Catherine, I'll let you.
We're very fortunate as well in that there are templates that assess the age friendliness of healthcare settings. So for example, a healthcare clinic, a hospital unit. And some jurisdictions have actually had older adults do walkthroughs with the checklists in hand to assess the age friendliness of that setting. To give you another great example, the City of Summerside's Age-Friendly Business Program actually partnered with older adults in the community to help local businesses assess their age friendliness and learn what they could do in terms of service, product presentation, customer experience to make it a more age-friendly experience. So it probably is the different settings will have different measurement benchmarks.
But certainly it's on the radar.
Yeah, and also I think building codes, change in building codes is going to impact on what's being built. And I think we can certainly monitor that building codes are kept up to a standard. And there's been issues already around, you know, that building that burnt. It wasn't up to code, and I think it's up to us as a society to make sure they are.
Great.
Fine, thank you.
Okay, Ole?
Thank you. So you speak about the islanders. Did you mention 800 that was receiving aid at home, or in terms of snow shoveling?
Yes, the Seniors Independence Initiative.
Yeah, yeah. So are those people living in their own homes, or they're living in apartments?
Yes, they're living in their own homes.
Are you saying it's only available to people living in their own homes?
I think apartments are counted as an individual's place of personal residence as well.
That sounds good, yeah, because I think it's equally important to stay at home, whatever you consider your home, including
It's
an
whatever their
apartment.
choice of home is.
Yes, yeah, it should be your own choice.
I do know some people who are benefiting from it, and I mean, it's a wonderful program, and it means they can continue staying in their home.
Yeah.
And one of those people is currently living in subsidized senior housing.
Yeah.
And this has been an add-on
Yeah.
that has enabled her to continue living where she wishes to
Yeah.
live, so.
So I heard some of the work getting done is shopping, snow shoveling, all very worthwhile thing. I was wondering, does it go beyond that to taking care of somebody in their home, like giving them a bath or whatever? Does it go beyond just kind of
As
just
a
shopping?
layperson in the community, my understanding of this program is that the actual funds are given to the senior themselves, and they decide what they need help with. It could be going on an errand, it could be Meals on Wheels, it could be shoveling the snow. So each individual senior has different needs. So my understanding is that the funding goes to the senior themselves. They themselves decide where they need the help, and it could be help with cleaning.
Okay.
It could be help with nutrition. It could be help with getting out to do something. So I think that type of program is wonderful, and we can add to it.
Yeah, exactly.
The other thing I will say is that there is, that's part of kind of a continuum of services, and so as you get to some of the more sensitive personal care, and then you get into the medical side, that's where like the home care program would take over, and you'd see services provided through a separate but complementary program.
Okay,
This
so
one is more sort of the assisted living piece that's,
Yeah.
you know, non-medical, et cetera, but there is a home care program as well that's separate and apart, but, you know,
Okay, that's good to hear. So
Yes.
there's a continuum of care.
Yes.
This is good. Yeah.
It's looking at health at its broadest,
Yeah.
you know, bringing in the social determinants of health as well.
Do you have any feeling how much dollar per person is a limit to what you have available?
For home care, you mean, or for this seniors?
For your program, then?
Yeah, that one will be operated through the other departments.
I'm reading straight from a sheet of paper here,
Yeah.
but for supports within the home, one can receive between $250 and $500 per month. The same for supports related to groundskeeping, so more of the outside. The same thresholds exist. And community supports like the errands, transportation, again, $250 to $500. So they could be stacked to $1,500 if you were in the lower income range and you had more significant needs.
Okay. So,
Ole? Oh,
so are there programs that take care of any structural changes, like, for instance, making a bathroom door big enough to get a wheelchair through, or ramps and stuff like that, that
The,
complements this?
the Senior Safe at Home program is an excellent program to access for that.
Yeah.
So for example, you hit upon an excellent example. It's often bathrooms and kitchens that need modifications in order to support people to stay longer. Yeah.
Yeah, there's also a more generic home renovation program, and I'm not entirely familiar with the qualifications of it, but I think it is also, there's income considerations there as well, so lower income individuals would be able to access funds for home renovations as well. So.
And it's well subscribed by seniors, that you aren't required to be a senior to access it, but it's well utilized by seniors.
Ole?
Well, I can't help but comment on building codes. Building codes, I mean, they do have a standard for wheelchair accessibility, but it doesn't really cover the full range. For instance, if you need a wheelchair that's like a small truck like you have nowadays, it, just fits through a code door. We just had a visitor in here the other day that just couldn't navigate through this building. So to what extent, or maybe so it sounds like a navigator is a great thing to navigate between what all the different departments are offering. To what extent are you keeping track of where you are with all these very lofty goals?
That's her job.
Yeah.
That's why we have her.
And of course, it hasn't really been that long ago since you started the whole thing, so.
But I will say again, like there was work that was occurring prior to the implementation council, because all these, these agencies, government departments in some cases, but also some outside agencies, during the creation of the strategy, they made commitments to do X, Y, and Z, and so they don't need us lording over them to say, are you doing this, right? They, like, Health PEI has made fairly substantial gains in terms of staff training with, for dementia training and things like that, so there has been work occurring, but Catherine is certainly keeping tabs on them. We've got sort of a running chart of where all the recommendations are, and one of the things that we've done early days in the implementation council is to bring all that information, because we have community members who don't have the benefit of sort of existing in the silo of government, and so we're trying to make sure they're aware of the things that are underway as well, so they're empowered to participate in the conversations as well. So.
And also, these groups, government departments and organizations were part of the development of this strategy.
Okay, great.
So they were in it from the beginning, and they made their commitments way back.
Ole, before we move on to Steve?
Yeah, I'm intrigued about your efforts to get seniors employed. When I was in my young 60s myself, I was trying to look for jobs, and it was really discouraging even when if I lied about my age, even in the 50s, I mean, as a rule, you would never get even a response if you applied for something. How are you going to overcome that?
Yes, I'm 83 and I'm working.
Yeah.
Inspiring, too.
I mean, I think, and I won't pretend to have an answer in terms of how we're going to overcome it. I think some of the recommendations do speak to working with employers to recognize the opportunity that's there for everybody on both sides of that equation. We've talked about the opportunities to have mentorship roles as we see young workers who have, potentially a lot of technological knowledge, but maybe not, the kinds of experience. And, there's some real world knowledge that I think everybody recognizes comes with time in the chair. There's sort of a number of, we've kind of talked about it, there's an employment cluster of recommendations within this action plan. And so some of them will be looking at sort of a task group around one recommendation, but I think we've talked at the last meeting, for the employment cluster, it makes sense to have a number of things that have a lot of overlap and complementarity. We'll probably try to advance those, kind of push them all along en masse so that we can have, I guess, a bit of synergy there, because if you educate employers of the benefits of, this older and untapped workforce, or largely untapped workforce, it also facilitates their increased employment opportunities. So if they can be brought forward in tandem, I think it's probably beneficial.
Great. Good question, Owen. We'll just move to Steve right now, and we'll come back around. Steve?
Thank you, Chair. This is a great document, by the way, guys. Is it a living document? Like, is it going to change as the reality we're in here changes? How long is this document supposed to be out for? Is it a 5-year strategy, or?
I think yeah, and then so we're a couple of years in, and like I said, there were a couple of things that we had to hit pause for. I mean, it is, I don't want to sort of tell tales out of school, but when there is an election called, government, there are certain impacts on the business of government. You can't sort of make big announcement. You can't make major policy decisions once that period drops. And when a new government forms, there's always a bit of a lag in terms of, making sure that the priorities that were already existing, we're continuing on. And it's just kind of the reality of being in government. Having said that, the council members, both community and government, they've been appointed to a 3-year term. In the work plan that we've been developing, we've come up with priority items for year 1 and anticipate priority items for years 2 and 3. We are trying to sequence them in a way that the year 3 ones aren't sort of the big picture ones that will require a lot of effort. I'm not sure that we'll wrap everything up by the end of year 3, but my objective, at least as the government side chair for year 1, is to try and set things up so that we're best positioned to advance as much as we can in a 3-year period. So I'm not sure you'll see in 6 years' time sort of a second iteration or a third iteration of the implementation council. I'd like to see us fairly aggressively pursue, oversee, monitor, collaborate, etc. to advance these recommendations.
Steve?
Thank you, Chair. Yeah, I was more getting at it as new realities become reality, and the reason I use the word reality there is because I'm thinking of virtual reality technology that's really coming online. I read quite a bit about how it can really benefit seniors and loneliness and well-being and dementia in its early stages as well. It seems to be promising. So as that kind of stuff emerges, is it something that can be incorporated into what's going on here? It's more kind of the flavor of what I'm asking.
Yeah, it could. My one caution is, with a 3-year time frame and 38, I always say 43 and Catherine corrects me, 38 recommendations. We have community representatives that we're relying on through this process, so there is a recognition that we can't sort of task them with too much. I'm trying to keep us sort of focused on the task at hand, really, which is our group has been constituted to implement and oversee the implementation of the recommendations specific to the action plan. It's very easy with scope creep to kind of lose sight of that objective, and I think the challenge is with issues that could come up in so many different areas when it comes to seniors, near seniors, and caregivers. It would be easy to kind of lose sight of that objective and potentially get distracted where we're not necessarily moving all those 38 recommendations forward. So I think we're not the only body by any stretch that will be looking after the interests of seniors when it comes to government activity. But I don't see us trying to take on new recommendations because, again, we've been constituted with a fairly specific mandate with respect to this action plan and the implementation of it. So,
Steve?
Thank you, Chair. Well, I just see some tie-ins with some of the action items you have there and the virtual reality benefits that can be accrued. Just on that note, I mean, there's not too many seniors out there that would be all up to date on strapping a VR headset on themselves and getting to where they needed to be and whatnot. And just along that note, is there any assistance with like a technological curve, learnings and help for seniors within the scope of things?
Well, there are some groups out there who are providing education on technology, like the Seniors College, the Seniors Active Living Center, they both offer, and EPSI in the Summerside area. So there are groups out there who are offering courses in using technology like the smartphones and their iPads and just using the internet in general. And more seniors know and do use the internet than we think.
Sure, Heath McDonald?
Another program that maybe you're aware of, maybe you're not, but when I was Minister of Finance, we had information technology services, and we provided computers to seniors free of charge.
Yes.
And I think, but the problem that we sometimes ran into is that, and these are refurbished computers that were wiped clean, and it was a great program, phenomenal actually. But the problem you run into sometimes is they can't afford the internet because they're at that level. So maybe that's something that you might want to take a look at.
Or they live in a rural area
where there's not.
Internet sucks.
Yeah.
You guys may have heard about that issue, I don't know.
I live in a rural area.
But it's certainly something they can take care of, and I'm not interrupting Steve, but there is a program there, it's good.
Thank you for the intervention, Heath. Steve?
I'm good. Thank
Okay,
you.
great, perfect. Natalie?
Sure.
Yeah.
Thanks very much for your time today. We certainly appreciate it. As my parents age, this is, I think for all of us, it just, this topic really resonates with me, and I have about 1 million questions, but I'll try to keep it fairly brief. But one area of concern for I think all residents in Charlottetown or across the island is access to public transportation. Is that taken into consideration in these recommendations? I'm just looking through it here now, and I'm not seeing it addressed, but certainly that's a barrier for anyone, regardless of age, accessing appointments, groups, education, so on and so forth.
It arises, I think, most clearly under age-friendly communities.
Okay.
Because transportation is one of those 8 dimensions. And so it was interesting as we came to discussions about supporting caregivers and older adults, transportation, and the limitations around social engagement, social connectedness, when a person either has retired from driving or for health reasons or personal reasons, in that can be a barrier to maintaining social connectedness. So, yes, that's an excellent point.
Are there?
Natalie?
Yeah, thanks, Chair. Are there any recommendations specifically, included in this document in terms of improvements that could be made, or where do you see the future of public transportation, I guess, for the island and the city in general, and as it supports seniors specifically?
It comes up at every meeting.
It does, okay.
Yes,
Yeah.
it's a constant because it is a major issue.
Okay.
And so how we can deal with it, I guess our council is going to be dictating where we can go with that because it is a major issue.
Yeah, I get, and to the best of my knowledge, it's not in here as a specific recommendation. And again, it's that fine line of, if we're tasked with implementing the recommendations as written, how far do we open it up and go back into some of the other areas of need, or is it sticking to generally kind of the
I
tasks?
think if we read it, it's there somewhere.
Okay, yeah.
Yes.
Yeah.
Fortunately, the Sustainable Transportation Plan that was recently released does have a focus on public transit. It doesn't necessarily mean that we'll not be making leaps and bounds forward, but I think the attention that's going to be paid to the implementation of that plan will probably raise the bar, both here in Charlottetown and across the province. It's maybe in different ways than we might be anticipating, but seniors will be some of the people to benefit from that.
Yeah, absolutely.
Natalie?
Thanks, Chair. So recently the government announced an active transportation fund, and they're looking for feedback and input into selection. Is there any information or feedback that you could provide to the committee in terms of what seniors might like to see going forward in some of the trail systems and active transportation?
So I guess it's not something we've talked about yet. I'm not sure when the deadline for input would be, but it's certainly the kind of thing I think we're offering ourselves up as, again, that resource. So if there's an opportunity to take it back to, one of the next couple of council meetings, I think we could certainly do that. And seek an opportunity to provide members, both on the government side and the community side, the opportunity to provide input into the process and give some feedback. So again, we're constituted in September. It's largely been about work planning, and we're just getting into the phase now where we'll be inviting organizations or groups to present for things where we see synergy, and or if they are spearheading work on one of the recommended action items that we can then sort of monitor, contribute to, etc. So that may be one of those, even if it's not necessarily mentioned sort of prominently in the plan, it certainly would support a lot of the other recommendations.
Yeah, absolutely.
Yeah, we can make note of that for sure.
Wonderful. That's great, thanks, Jeff.
Excellent. Corey?
Just on the Seniors Independence Initiative, what's the income cutoff for some of those
Can't hear you.
programs?
Can't hear you.
For the Seniors Independence Initiative, what's the income threshold before you don't qualify for?
Back to my trusty paper. For singles, for those with an income under 18,000, they are eligible for 100% of the amount that I pointed out earlier, the $500 top amount for each of those three categories. Between 18 and 20,000, about 75%, and between 20,000 and 133, about 50%.
So if,
And couples, pardon me.
I was wondering, yeah, that was my next question.
Then for a couple, 24 is the upper, or the lower threshold, pardon me, for the greatest amount, 24 to 27.6 for the 75% figure, and 27 to 31.3 for the 50% amount. Sorry.
Do you think those perhaps are
No,
good enough? No.
needs to be, needs to go up.
Yeah, I would agree, because I know I had I had a couple call me probably back in this late spring, and they had, one's a retired teacher, and so she'd have a pension, and her husband is ill, but she's looking after him at home, and but they don't qualify for any help with this because they're just above the income threshold. So anyways, that's just a comment I have. And you had mentioned, Sean, that the change in government and things slow down and priorities of different governments. Do you guys feel that you have the support from the current government that you need to carry out this?
Yeah, because I guess the signal check mechanism we used was the actual creation of the implementation council. We went up to the new executive council, proposed the implementation with the clear understanding that government tends to operate internally a lot of the time, but to be very blunt, when you open the door to community members, failure is not really an option anymore, because we have, multiple community representatives sitting around the table, so we can't pretend we're doing something that we have no intention of doing. So I guess my read on it, for what it's worth, is that once that was endorsed by the current executive council, that was kind of the green light that yes, we support this endeavor and all that goes with it. So. And I like to think we made, the implications of all this pretty clear up front, so that's my read on it, so.
It's good to hear. Usually Sean and I battle it out on the soccer field.
Yeah, I was hoping you would remember that.
Usually I yellow or red card him. He's yelled at me lots.
Yes, yeah, I'm a better person than I was on the pitch.
No, it's all good fun though.
You guys agree that?
Yeah. I'm good, thanks.
Heath, did you have any follow-up?
Yeah, just in regards to, and it's relevant to what Corey was talking about, and as MLAs you do get lots of calls, and sometimes you turn around and say, look, the threshold is not there, it's not there for housing, it's not there for what have you, but it'd be interesting to be able to, or maybe I should ask, are you tracking those types of inquiries, that the one Corey talked about So there is something substantial to take back to government and say, you know what, if we raise this 5% or something, or 10%, whatever, we're going to bring this into the category. Because I remember, I think, the last year we were in government, there was actually money left in the pot, and they did another recall for one of the programs. I don't recall which one it was. So I guess I'm saying, if that's the case, is there an opportunity to increase the threshold in some of those programs? Because obviously, there's going to be more and more people with the demographic changes rapidly changing that are going to want to take advantage of this, and sooner or later you will. Anyway, just a thought, question.
I wouldn't be part of the on-the-ground delivery of the program, but anecdotally, in preparing for today, I was made aware that some people would prefer, obviously, higher threshold to benefit from this program, and I can certainly take your recommendation back to the department that maybe monitoring would be valuable. I can say that the program is essentially fully subscribed now, that sometimes new programs require both promotion and the good old word of mouth to do its job. So we are reaching a significant number of individuals now.
I will add too, one of the benefits of having multiple departments represented is, I guess there's an information flow both to and from those departments in terms of some of the programs that we may be trying to influence or impact. Jennifer's from Social Development and Housing. We have Nelda Pratt from the Education and Lifelong Learning. So there's a couple of representatives from Health PEI, Chief Public Health Office. So multiple agencies are represented. So while it isn't our job to kind of monitor, I guess to your direct question, we're probably not collectively trying to set a task where we monitor that stuff. I think as our deliberations continue, as the task groups get formed to sort of get into some of maybe the more tangly issues, I'm hoping that the two-way communication, both to and from departments and then also to and from the council to the task group, will allow for some of those concerns that crop up to be brought to the fore so that they'll influence some of the decisions that are made.
Yeah, thank you. And I think, looking back at some of these programs and seeing some of the vulnerable part of society that certainly take advantage of them, I don't think it should be a blanket threshold, and maybe it's not, but I'm from the understanding it is. Maybe certain of these programs can change, the thresholds without some of the other ones changing. If that's the case, so be it, if there was better data to support it, I think. Anyway, that's fine, thank you.
We try to think of programs and services being there to help increase the capacity of people who are already trying to do things. I don't like thinking about older adults as always being at risk.
Right.
Because I think they have a lot of capacity, they have a lot that they can offer, and sometimes it just means they need a little bit of support to continue on. So we have to start thinking about capacity building as opposed to those who are at risk. Because when we look at it that way, we're losing out.
Perfect. Well, I'll just wrap up here because we'll wrap up in 2 minutes, and just had a couple little things. There's always a fear around seniors being active, and I think that we're lacking behind on that in our province. I think that seniors need to be active and they need to keep moving. So when we're looking at maybe a 2.0 round of this, and I've worked with 89, 95-year-olds, 96-year-olds, there's always the capacity to move. And this program this plan kind of hits on things, but it doesn't address the root ability that we need to move. So
that's why we're looking at upstream.
Yeah,
we're
upstream,
looking at the root causes.
Yeah, exactly. And I think about Dr. Herb Dickieson is here with us, and he's going to present later how many people have been into his office after they've had a fall. And I'd really like to see a robust falls prevention program in Prince Edward Island. And I'm so glad that you were in this committee today, and we take this very seriously. And I think that we all want to see increased fundings funding to the programs like the Seniors Independence Program too, and I think that's something that we can take back, and we will make a strong, hefty recommendation to the Ledge in a couple months. But your time here today was very, very valuable for this committee. So maybe I'll leave the last word to Olive, because she's done an incredible amount of work and she's an inspiration. And if there's anything that you want to say on behalf of the committee, this is the time.
Just on behalf of the committee, I am really pleased that you're listening to us and that you're hearing what we're saying, and that you're willing to look at our older population as an opportunity and not as a barrier, or as, I hate it when I hear them talk about the tsunami, the gray tsunami, and that's horrible. That's very disrespectful. So I think we need to start looking at ageism and how it's impacting on how we think about our older adults. So thank you. I think they're wonderful, and I work with the 85 and older, and I think they're absolutely amazing. So.
Well, that's the final word. Thank you guys for being here today. And we'll take a short 2-minute recess, and we'll come back. This will be a very short transition. Thank you. Welcome back. We're excited to be moving on with our meeting. So we have a great former MLA, Dr. Herb Dickieson here, and has done a lot of work for our province in terms of patient care and being a doctor, and as well as MLA, your MLA duties. So we're really excited to have you here today. So I guess you do not have a slideshow, but the audiovisual material will be making a primary verbal presentation of prepared text. The text will be made available after your presentation for the public. So great. So I'll pass it over to you, and we look forward to hearing from you.
Well, thank you, Mr. Chair, and honorable members of the committee for your invitation and an opportunity to present my perspective on the issue of physician shortage on Prince Edward Island. It's not included in my resume there, but I actually began my first interface with the medical profession or healthcare was as a medical assistant in the Canadian Armed Forces, or as the infantry referred to us as the bedpan commandos. So I can say from that perspective that I've seen healthcare from all ends. But in any case, I went on from there, and I worked as a nursing attendant at Hillsborough Hospital as well, and it gave me a perspective of mental health and how its implications and challenges. And as well as growing up on a dairy farm on Prince Edward Island, it certainly provided me with that work ethic and my work in the armed forces and that, the teamwork, and through the hospital work as a medical assistant, as a patient care-centered focus, which provided the foundation for me to enter medical school and obtain the knowledge and practical skills to fulfill my dream to become a medical physician in rural Prince Edward Island, which I happily have done for 30 years, or as I like to say, 45 years if you count my overtime. But in any case, it's become very much apparent from the 2000s to the teens, and now in 2020, is that there is a growing shortage of physicians on Prince Edward Island. Every time I make this presentation, I have to change the number of patients seeking a family physician, and we're now exceeding 16,000 on Prince Edward Island, and that's only the ones that are officially registered. I suspect it's higher. So it's aside from what is evident in our own situation and our communities, it certainly became blatantly clear as the Medical Society rang the alarm bells about a year ago, and they did a survey and found that within 5 years, 56% of physicians will have either retired, moved to other places, or cut back on their practice. So as bad as the situation is now, if we don't do anything about it, it's going to be worse. And this is not a problem that just has suddenly emerged. This has gradually developed over the last 20 years. And so it's something that I think we have to take a very proactive approach. And I don't discount the efforts that the government is making. There's been some progress made as well. And I forgot to mention in the very beginning, I meant to say this, is that I appreciate the efforts of each of you on this file of health and social development. And particular attention here to Mr. Daigle and his courageous efforts to take on a very important issue of vaping and gaining the support of his colleagues and bringing that change here in Prince Edward Island. And as well you, Mr. MacNeill, for your efforts in preventative health care through your work in the as a life coach, and you made my sister Helen MacDonald very happy. She thinks highly of you, and so this issue that we're facing is very serious. It's getting worse, and I think we're going to have to work collectively to address it. And the approach that I'm presenting is one that deals with the problem for the short term, the intermediate term, and also in the long term. The short term aspect of it is to accelerate the recruitment and retainment of physicians in Prince Edward Island. This is probably the most costly part of the whole program, in the sense that there's a lot of obstacles in terms of attracting physicians and getting them settled on Prince Edward Island. You have issues of immigration, issues of medical qualifications, there's language issues and proficiency that has to be met in order to provide health care for Islanders. And over and above all that, there's the issue of a physician and his or her family coming from other places in the world, possibly with more genteel climes than our winters on the island, and having them come to settle in the community somewhere in PEI and adopt a full load of patients. So there's a lot of challenges involved, but we do have some assets on our side as well. Prince Edward Island is a peaceful part of the world. It's one where we have great community spirit right across the province. We have a unofficial system of mutual aid that happens when people are in trouble on the island. People often work together, whether it be to build a new rink in Tyne Valley, or to get a hospital, or get a physician in the community of Crapo. People, when they see a problem, they come together and they try to address it and deal with it. So that's a great resource that's there that doesn't, it already exists, and would cost the government too much money to get going. We do have to spur that along a bit and do our part to ensure that happens. But so the issue of physician shortage is not merely a situation of the delay in seeing a physician, the delay in getting a diagnosis, the delay in getting treatment, and also raising the risk of worse outcomes through those delays. There's also a financial impact on communities, both large and small. And there has been a study put out by the Fraser Institute. I don't often refer to the Fraser Institute, but they had pointed out that across the country, due to wait times, and PEI was one of the worst, that there's an individual cost of something like $2,300 due to the average loss of income, the loss of productivity the workplace. And it does have a financial impact that affects our bottom line in the province. There is, there are ways that we can approach this problem, and as I said, the immediate, intermediate, and the long term. Immediately, we have to have a facilitated recruitment and retention program. I know that government is making efforts in this area, but they need to be accelerated. Due to the numbers that the doctors put out last year, saying that we're going to have that big reduction over the next 5 years, we have to move faster. We have to really do something about this. I know that a large investment was promised by the outgoing government last year, and I don't have the figures to see how much actually got translated into the budget for this past year. But certainly we need to have that accelerated program, not just the money, but as I say, that community involvement that's so necessary and has been pointed out by the group from Crapo to work as a community, to bring things together. There's the private sector can be involved as well. Oftentimes, pharmacies will provide space for physicians, or even I think the town of Borden was even offering space that was owned by the town. So it's going to take a bit of coordination to make that happen. But as I said, this part of filling that gap is costly. And I think we have to do that because we're dealing with an emergency, but we also have to think of the future to make it better. And so the interim or intermediate term, we need to increase the number of residency positions on Prince Edward Island. So a physician will obtain his or her MD off the island right now. They come to Prince Edward Island as a new graduate, and right now we only have 5 positions available through the residency program. The Minister of Health has said we're going to increase that to 7, and that's good, but I really think by September we need to have 10 to really match this decrease in physicians that's happening. And another year later, or soon after, as soon as possible after, I think we need to increase that to 15. If we're going to match those numbers that have been pointed out by the Medical Society of Prince Edward Island, saying that we're going to have 56% of physicians either retiring, cutting back their practice, or moving out of the province over the next 5 years, it's not inappropriate to call it a crisis now, but it's going to be even much worse if we don't act soon. The last, or the third part for the longer term is something that will cost government the least amount of money, ironically, at least in this budget. Because, and I did have a chance to speak to the budget consultations, pre-budget consultations the other day, and this part requires the least amount of money this year, and that's the medical faculty at UPEI. In order to establish a medical faculty at University of Prince Edward Island, so that our island students can be educated on the island and obtain their practices following that, it's going to take a couple of years of negotiations and planning. So what we really have to have in place immediately, and I wish we had it in place last year, is a commission, a task force, call it what you like, a group of professionals and people with the expertise to really take a look at this idea of medical faculty at Prince Edward Island. That would be a very small portion of the budget from this year to make that happen. We don't have to reinvent the wheel in this regard. This has already happened in New Brunswick. They had the foresight back in 2000, in the early 2000s, to build a medical faculty at the U of Moncton, where they graduate 24 francophone students each year. It's a satellite faculty coming from Sherbrooke, Quebec. And so soon after, in 2010, they open another faculty at University of New Brunswick, St. John campus. And my son's partner is a second-year medical student in that program. And so this has already happened in our region, and it needs to happen on Prince Edward Island. I wish it had have happened 10 years ago. Then we would actually be being treated by some of these new doctors that would have graduated from that facility. It's a rather unique situation that we're in right now, because we have a lot of the factors just there that need to be put together to make this happen. First of all, we have the need. I think that's been well demonstrated. We have the support for this as well. The City of Charlottetown has voted unanimously for this plan, for the 3 points that have been outlined. The City of Summerside as well has backed this plan. They did it through committee first and went to their general council, and each of them have endorsed this plan. There's many other communities as well across the island. Montague, or should we say Three Rivers, has endorsed this plan as well. As Stratford and Kensington, Borden, Alberton, O'Leary, Tignish, other communities all have said this is the way to go. So we have the support of a large majority of islanders through their elected civic representatives who have said this is what we need to do. So I think we need to listen to them and listen to islanders, and I think we have to act now to address this problem. And so I'm hoping that your committee will take these factors into consideration and recommend to government that that we proceed in this manner to accelerate our efforts and to get things started so that we can get that medical faculty at the University of Prince Edward Island. So with that, I thank you very much. Oh, I forgot to say one thing. There's also increasing political support for this, other than the civic representatives across the province. There's also, on the federal level, we have representatives from different political parties. Anna Keenan, the Green Party, is very supportive of this plan. We have the New Democrats, even they say they're supporting it. And then we have as well two of our MPs, elected MPs, have also endorsed the plan as well. So there's a lot of support for this idea, and we have all the elements. And there's one other thing I forgot to say, is that we have a very special president of University of Prince Edward Island, a president who has created a faculty of engineering at UPEI, or led the efforts to create one. Also a president who has the experience in setting up a medical faculty in Kelowna, BC. our President Aziz has been involved in the establishment of a medical faculty in Kelowna, BC, where my nephew is a physician, just as an aside. And that's based, that it works out of the University of BC, but it's in Kelowna, BC, in the inland, or they call it inner mainland of BC, and that's working very well. So here we have a president who has the experience in helping make this happen. We have the need, we've got the community support, we have growing political support. I'm hoping we have your support too. So with that, I'll open to questions.
Well, great presentation, Chairman. We will open the floor to questions. We'll start with Steve Howard.
First, if they want, you want to get the transcript ahead.
Sure, yeah.
I didn't look at it while I was reading, but I felt comfortable
No, you
with
did
it in
great.
front of me here.
Great. Perfect. Thank you very much.
And I didn't follow it exactly line by line either.
I guess we could go ahead with his question now. Okay, Steve, just when your mic's not on.
Sure, yeah, it's a quick one.
Just hold on a sec, Steve, your mic's not on. Is it on? Okay, perfect, thank you. Go ahead. Sorry.
Did you mention a cost while you were talking there about setting this up? I think
No,
missed
I
it.
didn't say that, but I'm glad you asked about it. The President Aziz tells me that the faculty that he set up at Kelowna cost $34 million. And that's a few years ago, so those figures may have changed a bit. And but yes, there is a cost to this, and there's a cost of not doing it as well. And that cost has been pointed out, as I mentioned, with the study from the Fraser Institute, with the delays, the wait times, the inconvenience, the pain and suffering, and the delayed diagnosis, and increased risk of worse outcomes. There's a cost as well.
Steve?
Thank you, Chair. So Kelowna's, like, would we be talking a similar sized setup here? Is this a comparable number to use here, do you feel?
Well, I think a few years have passed, so we're probably talking 50 million, if for that. But that's not money that would be have to be paid this year. The only thing that would have to come out this year is to set up a commission to do the cost-benefit analysis, to begin the planning and negotiations, and then you have this cannot. As in New Brunswick, this would not be a entirely provincial cost. This would have to have participation from the federal government. And as I said, we do have support from some of our elected MPs to help make this happen as well. And then you have, it would be an amortized cost over years as well. In terms of revenue generation, you can have a mix of students, including students from other countries that would be paying higher fees as well. That would be one part of the defrayment of cost. And then you build it into the provincial financial structure that we have in terms of our negotiations with Ottawa.
Steve?
Thank you, Chair. What about a timeline? If all that went well and they said, yes, let's do this, do you have any feel, or would that come from this consultation that would happen ahead of time kind of thing?
I think it's going to take a minimum of 2 years of, if you folks say, government, let's set up this commission right away. It's going to take 2 years. You're going to have to put all the facts and figures together, do all the planning and negotiations, cooperation with the communities, cooperation with the federal government. It's going to take a minimum of 2 years to get the shovel turning soil to open it, I would say.
Steve? Yeah.
So what sort of succession plans should be in place in anticipation of physicians leaving or retiring? It's not related to the medical faculty and whatnot, I don't believe, but do you have any thoughts on that?
There has been talk about succession plans, and as I was president of the Med Society a little bit ago, and there had been programs sort of set up with the government whereby if the physician is going to decide to retire 2 years, then there can be some sort of matching and work with, but I don't know if it's worked all that well. And despite the good effort to make that happen, I think you do have situations where you have physicians who really don't feel that they can't quit. If I quit my job, my hospital's going to shut down. And this is what we're looking at. We've already lost some of our hospitals, but you take the hospital in Montague or in Alberton, if they don't get support, physician support, real soon, the doctors that are struggling to keep it open are not going to last, and those facilities will close or they'll be downgraded. They already have been downgraded to some extent. So we need action. We need it right away.
Steve?
Thank you, Chair. So on the retention side of things, it seems to me that like burnout is a big problem and work overload for the doctors that we have here. In your opinion, would it be more beneficial to limit those work hours and retain our doctors in the long term, or to try to work the doctors we have to deal with the issues we have? I mean, there seems to be a give and a take there. Is there some sort of sweet spot that might ease the burden?
I think doctors smarter than I was when I was practicing. I found that the practice didn't end unless I left the community. But even then, I had a pager and would usually know what was happening. But it's very hard, especially in a rural practice, to limit your practice. When your neighbor is not well, and if you say, well, I just can't work anymore, and the administrator says, well, we don't have a doctor to cover the next ER shift, it's hard for a doctor just to say, well, hands-off approach. I think I'll just take the weekend off and relax. I went out to Tim Hortons one day, and as I was passing through to pick up my coffee, as the server was holding my coffee, she says, "Would you be my family doctor?" And how can you say no to someone that's holding your coffee?
Good advice.
Exactly. Yeah, great.
That's fine.
Okay, Steve. Heath?
Yeah, sure. I don't think it's a bad idea to investigate this. I think it's actually a really good idea, and we are coming up to a crunch time when we're at over 16,000 people without a doctor, and as we all know, it could get worse. But I guess some of the things that kind of throw back to you when you start talking about this in the public is Nova Scotia has a large medical practice in Dalhousie, and they're affiliated with whoever, and they have a doctor shortage. So I guess they always kind of throw that negative back at you, like how do you respond to that, or how do you what is the link between doctors and medical schools, and if there's a shortage in Newfoundland, if there's a shortage in Nova Scotia, and they both have schools, like how do you kind of make that link, I guess, is what I'm...
Yeah, it's a good question. What they're finding is that physicians like to practice close to where they've been educated. And there was one poll by the CBC that said something like 2/3 of physicians like to establish their practice close to where they've been educated. If you can, if we had a medical school here on Prince Edward Island, oftentimes is that time in your life when people are finding spouses, when people are perhaps investing in houses, and if they have an island spouse and an island mortgage, then that's one more attachment they have to PEI, and they're more apt to stay. The thing is, it's quite a long period of time that one spends through the educational system and in medical school to graduate. About 6 years actually of the medical school part, 4 years basic medicine, and 2 more years. So if we can have, rather than just spending the 2 years on PEI as in the residency program, which is too far limited right now, if we had them here for the 6 years of their whole medical school, there's a much greater chance of them developing those links and that attachment to stay here on PEI. And the other thing is, the other thing is having a medical faculty in Prince Edward Island. 2 other things. It will really enhance our healthcare on the island. A lot of the CME, continuing medical education, can happen right in affiliation with that. And also, there's a lot of cross-pollination between paraprofessionals, where we have a nursing school, we have a medical school. We can develop there's other occupational therapists, physiotherapists, a lot of other activity and education. It could be kind of a health sciences faculty, where you can develop a lot of those skills and collectively improve our whole healthcare system on PEI.
Heath?
Has anybody ever talked to Dalla Memorial or Sherbrooke or those, like I'm assuming you have contacts, has President Azia or anybody has there been any steps in that direction at all, or is it still kind of very preliminary?
Well, like I say, a lot of the elements are in place here. The need, the community support, political support that's growing, and the fact that we have a president of UPEI who's so well acquainted with the issue. The element, in order to get this thing started, it has to be a move from the government. The provincial government has to give the signal that yes, we want to look at this. Yes, we want to set up a task force. Yes, we want to set up a commission, call it what you like. We got to start the process, and then those things will develop from that. Then that would include the planning, the negotiations, talking with Dalhousie, talking with other medical schools as well, and finding that way to make it happen. The elements are all in place. We just have to get it started.
So out of the 50 million, Herb, do you have any idea what percentage of that is based in the infrastructure or operational side, or is that 50 million to get it going? Like, does anybody have any idea on the cost on an annual basis?
This is why we have to have that commission. Okay. We have to have all these details worked out and sorted out, and really the good planning to take place. And like I said, this will not fall completely on the shoulders of our province. In New Brunswick, they had support from the federal government to have this happening, and it would become part of the financial structure, which you know more about than I do, between the federal and provincial government to make this happen.
Just a footnote, you mentioned the engineering school. When I was talking to the dean not too long ago, he was telling me that they had 2 of their students graduate engineering and then went into medical, went in to be doctors. So they're pretty extensive background. Maybe they could design the building and then work in it.
Exactly. Well, there is some pretty rough stories, and you've heard them yourself, where we have island students who wanted to get a medical education and couldn't access it and went to the Caribbean. I know of at least 2 who spend loads and loads of money in their family. I know one family not very well off put everything they had to help their daughter get through medical school in the Caribbean, and she can't get back into Canada to practice. And that's lost opportunity. There's other islanders, like Anna Keenan mentioned herself. She would have thought of going to medical school if it had been close access. You know, there's people on the island, young people, who would perhaps go into the medical profession if there was that easier access to medical faculty.
I might ask a couple of questions here. This is great because we've got a theme in this committee about retention and recruitment. So I guess that's our end goal. So it's nice to hear from you about getting there. And I guess what the committee's trying to picture is this the right strategy? I mean, I look at this as we wouldn't be producing doctors for 8 years.
Right.
You know, so this doesn't.
That's why we should have started 8 years ago.
Yeah, exactly. Should have. But it's the timelines. And then the other question I had was professors that teach the program. Because if UPI's, or if we're looking at UPI to develop its own program, the professors what's the process for them to become teaching professors versus regular doctors? And would it be tough to recruit them to come to Prince Edward Island to teach?
There will be challenges, and that would be one of them. But right now, we have some great physicians on PEI who have teaching skills. And some of them, I was a preceptor myself for some medical students that come through. And I mean, it's part of our creed is that is to help your colleagues and help them along. They'll need some support to doing that, but there are some skills, some people with that talent that are already on Prince Edward Island. Some of them perhaps approaching retirement would want to teach and less time patient contact, and some people will have to be imported. But it's all part of building a medical faculty, or building a faculty of any sort. You will have a blend of local and people that are coming from elsewhere.
Because then I would guess that we have agreements with Dalhousie Memorial for seats, and each seat costs about, I would say, about $75,000, if I'm correct, and we send students over there. And has that been a good approach over the last number of years to get those people that we've sent to medical school back? And wouldn't we look at increasing that complement in the short term? Would that be a...
Well, it was good enough for me to come back, but it doesn't work all the time, and it could be a short-term measure, but really, if we want to fix this problem in the long run, we have to start educating doctors right here in PEI.
The Medical Society, we've talked to the Medical Society to come in to talk about, we're in Prince Edward Island right now, the minister has been talking about a split recruitment strategy between the department and physicians, recruiting physicians. We're even having a tough enough time to get the Medical Society to come in to talk about that, and that's giving them a 2-month window. What would it be like if they had to be tasked with developing an entire, you know, this program that we're talking about? And what's your communication been with them?
Well, just to use an analogy, if you have a workshop where the workers are working full out and using as many hours of the day except for a little sleeping time, probably not enough. And then you say to the workers in that factory, okay, can you help us get some more workers? There's a lot of stress on physicians across PEI, and they're working full out, and it's kind of scary, you know, when you know, what's government going to want us to do? Is it going to are we going to be able to do it? And that it's a bit of an ask, but it's something that needs to happen as well.
I'm glad you're bringing it forward to this committee, so it's great.
Move to Corey.
Thanks, Chair. One of the questions I had is the Medical Society, are they involved in the licensing of doctors?
There's two bodies. One is the Medical Society of Prince Edward Island, and they're involved with education and coordination of the physicians and also negotiations for contract. Then you have the professional association, the College of Physicians and Surgeons of Prince Edward Island. So they're responsible for the conduct of physicians and to maintain high standards in the practice. There's one other element, is the government itself that has control of the billing numbers. And that was one of the things that I actually have in the written part, is that we do have, or at least had when I was there, an assignment of billing numbers for regions. And I know there may have been some effort to say, let's not look at those billing numbers for certain areas. Well, those billing numbers for certain areas are important because they do provide some assurance that this region or that region will be assured that this is how many positions that you're entitled to. And that's what you folks control. Corey?
Because I do, I know a lady, perhaps you know, Marta Irvine, from Summerside.
Okay.
Anyway, she's lived in PEI now for quite a long time. I'm not sure if her husband's a doctor or not, but I think she's an anesthesiologist. But she just can't practice. She just never bothered getting her license here because it was too difficult to write the tests. And is that a barrier to recruit doctors?
Like I was saying, there's a lot of barriers for physicians moving in from out of country. There's immigration issues. There's licensing issues because their training might have been a little bit different. Education might have been a little different than what was in Canada. And there's language abilities too is important. There has to be a certain language skill to practice. So there's a lot of barriers. And like I say, we're in a dire situation now, and we have to reach outside the country to bring in physicians. And we've had some great physicians on PEI practicing today. They're from other countries. And I think a certain amount of that is a good mix. As in any profession, it's good to have local folks as well as people from other areas, even Denmark and whatnot. Is that where you're from? And it's that international mix is a good thing, but at the same time, we have to become more self-sufficient and educate our physicians on PEI. Corey?
Do you think that that barrier of licensing is too stringent to recruit doctors from out of country?
Well,
because I feel like it is, but that's...
And a lot of people feel that way too. It is important to have a high standard, for sure. In Canada, we have 10 or 13 licensing bodies. A lot of countries, most countries just have one. Some people say, well, we should have a regional one, like in Atlantic Canada, or it should be a national one, where it's the same standard right across the country. They have a lot of responsibility when it comes to making sure that physicians are qualified, and we want to make sure that our patients are safe and going to be well looked after. So there is always some debate around that particular issue, but it's patient safety has to be placed in the forefront.
Ole?
Thank you. I must admit, of all the campaign promises thrown about a year ago, the hospital, the medical school was definitely the most exciting. Well, what I was wondering is aside from the medical school, is the hospital up to it being a teaching hospital? Do we have the other facilities?
Well,
Or is that up to the commission?
no, it's a good question. I mean, part of a physician's education involves, especially when you're starting, it's more general and then it gets more specific as time goes on. But for the family practice situation, you want to have access to clinics. They can, part of their education is on-the-job training, one might say, in clinics and in hospitals. And I certainly at the family physician level, there will have to be some structural issues in terms of setting up programs. But I'm quite confident that we have that capability on Prince Edward Island. With regard to going on to further specialties, such as surgery and cardiology, and that may require going off island, for further education.
Ole?
But once a medical facility is established, I would imagine they'll have 20, 30 doctors on the faculty. They would, as an entity, also provide medical services in
Yes.
parallel. Would they not sort of significantly boost the capacity?
Well, that's
island.
exactly right. And when I was in medical school at Dalhousie, most of our professors were practicing specialists in Halifax. So they were practicing through the day, and they come and give their lecture and then back to the hospital.
Okay.
Ole?
Well, the last question was more on a kind of personal basis. You kind of half answered it already. I take it you just retired yourself, and it sounded like the only way to retire up there is by kind of shutting the doors completely. Are there in fact barriers to practicing part-time on PEI? You hear very little about it happening. Does it happen?
A lot of doctors do that, and they just kind of ease back. And there's a certain percentage I gave that doctors plan to do that, cut back in their practice. Whether you're doing a small practice 1 day a week or a full-time practice, you still have to maintain your skills. You have to continue your medical education, and it's a lifelong learning process. So yes, you can do that, but that means you have to at the same time immerse yourself in all the continuing education that's happening as well.
Okay. Thank you.
Just quickly wrapping up, how much a commission report in your ideal world, how much would you like to see allocated in the budget for that?
Well, it's something I haven't made the exact calculations, but there's certain people that you would want included on that commission. Assume you want people from the University of Prince Edward Island. You'd want some physicians, or at least one. You'd want to have people within our government, people from the finance department, and it's just hard to say exactly. I mean, some of those people are being paid anyway. The ones that are working within our government at the present time, and some people would have to be seconded to come and work on the committee. But I can't really. I'd just be guessing if I was to say that. It would seem to me that it would be pretty low cost, though, in terms of it's a necessary part of of getting medical faculty. You have to have that group come together. Perhaps Mr. McDonald might be able to give a better figure. If he can't guess it, I can't.
And our job is going to be to present to the Legislative Assembly here in a couple months. If there was two things that you could pick out that you would like to see in our report, what would those be?
I'd like to see the three-point. This is not to say that government is not already acting to some extent on at least the first two, but we need to up our game on the recruitment and retention. We need to work with our communities. I think recent statements from the minister says that he does want to work more with the communities, and that's important. And those people in the communities that will volunteer and be part of the process. We have to increase the number of residency positions. It should be 10 in September, and it should be 15 next year. And the medical faculty. That's where we have to set up that commission, task force, whatever you want to call it. I don't know what the proper word for it, but it needs to be a group of people who are going to really dig in to the details on this and get it going. So those are the 3 points, the 3 recommendations that I make.
Well, on behalf of the committee, I think you served Prince Edward Islanders well your entire life, and you've done it again today, and we were really glad to have you, and there's a lot of good things here, and you know, you're doing all this by volunteering and because you care about continuing on with doctors in our great province. So would like to thank you for your time.
Thank you very much.
And just stay seated, because we're gonna wrap up really quickly, because five. I don't think there's anything that I need to read. The committee's been here for a little bit, so we're working on things. So if I can, that was just a work plan document. A lot of substitutions in today, so we'll be looking at that next week. And then if there's no new business, which I kind of scanned the room there before, I don't think there's any new business. So if I could get, if it's okay with everybody, just as I scan the room, Corey?
On the Kings County Memorial Hospital, Edna Miller said she could come and present. Is that Sean?
Sean?
Yes. What she told us before is that they intended to present, and they were looking at a date sometime in late March.
Okay.
They haven't picked a specific time yet. If memory serves, and I'd heard similar late March dates floated by a few people associated with the medical files we're working on, that they're sort of working around doctor schedules, March break vacations, etc. That for a few of them, late March was when they thought they could most likely get somebody in.
Okay, and did she have a group of people that she...
Where we had left it with her was she had, over the course of a couple of emails with me, some questions about the specifics of what the committee wanted from them, what sort of information they were looking for. I'd supplied some of that in the mail itself, and also directed them to excerpts from the recent transcripts that covered the kind of stuff they wanted to know.
Okay.
And she was saying that would help basically select the specific people they would need for the appearance.
Okay.
And that she'd get back to us when they'd figured that out in terms of which people specifically they had and what their dates would be. But again, her first guess on date was sometime in late March.
Okay. Hopefully we can get them in before the legislature sits.
Well, you just let us know if you need us to take further action. And
Well, yeah, they're going to come and meet, so it's that's the next action. So
anything else this time? No. Great. So I will call for a motion to adjourn. Ole.